Imagine a young woman building her career, planning a wedding, and raising children. Now imagine her being diagnosed with breast cancer. Right now, doctors are seeing more patients being diagnosed in their 20s and 30s. Breast cancer has long been considered as a disease that mostly affects older women, but that's all changing. The good news is treatment is also changing. New technology is helping with less invasive procedures and also helping some patients keep their hair during treatment. And that is thanks to scalp cooling. We'll be joined by three special guests today. But first is Dr. Noran Berry, a breast surgeon at Sharp Healthcare. Thank you for being with us today. And you are one of just a few surgeons in the country who is trained in a new procedure. It's only available in 15 hospitals nationwide?
That's right.
Okay,
That's
explain exactly what it is and how it works.
So we're really proud to be one of the first 15 institutions across the United States to be able to offer this. It's a robotic nipple-sparing mastectomy. And so what I do is I use a robotic instrument, not an actual robot, and I'm able to remove the breast through a very small incision hidden under the underarm. And so patients can essentially look in the mirror and it makes it look like nobody was ever there. And it's not a constant reminder of having a breast cancer treatment with long incisions, long scars on their chest wall. So what makes us really proud is that, we're the first to offer this in San Diego at Sharp Mary Birch Women's Hospital. And our patients have had great outcomes. It makes them feel a lot more confident and just feel a lot more like themselves.
So were you chosen to be one of the few surgeons across the country who can do this, or is this something that you saw as an advancement coming down the pipeline and you thought, I'm going to sign up for training, I'm going to get certified for this, or whatever the word may be to do this? How did that process work for you?
So Intuitive is a robotic platform company, and they chose the 15 total surgeons to be a part of this.
Wow.
So they look at outcomes, they look if we have a dedicated team, and they just look at our general sort of volume and how well we're doing as surgeons. So yeah, it's a really exciting opportunity, and I'm looking forward to it. There's a lot of benefits. So for example, not only do we have a small hidden incision, but patients actually can have preservation of sensation on their skin and their nipple, which is not a typical thing when they're undergoing an open nipple-sparing mastectomy. So it just gives patients the confidence back and allows them to be, their full selves.
And that's important as they're dealing with breast cancer, because it can be emotionally painful as well as physically as well. When we're talking about double mastectomies, you just lose part of the feminine side of yourself. So doing some technological advancement like this helps them feel not only like themselves, but also still feminine and sexy if a woman wants to feel that way, right?
Absolutely. And I think that the key here is we really want to have it so that cancer takes less from you. And this is just an incredible way to do that.
What other advancements are you seeing that can help preserve that, taking less?
So scalp cooling is one of them. So I know that we'll talk about that a little bit later in the show. But another thing that we can offer surgically is something called resensation. So patients who have open nipple-sparing mastectomy, I can actually sew a nerve graft so that they can preserve the sensation on their nipple. So that's aside from the robotic approach, which also adds the smaller incision.
That's wonderful.
These are all new advancements, and there's a couple of places doing that as well.
So let's talk about the younger patients that you're seeing. Why is this happening? Because it was long thought, and we talked about this in the introduction to this episode, this was something that impacted women over the age of 50. Now you're seeing it in 40, 30, even 20s. Why?
It's a great question. I wish I could answer it fully. But what I can tell you is that our screening is better. And so patients are getting, their cancers are getting picked up younger and younger. Patients are being encouraged to get screening at appropriate ages, so starting at 40 and annually thereafter. And then also, I think some of the biggest risk factors are environmental risk factors. So stress. I talk about this all the time with my patients.
Stress can cause cancer.
100%. And there's a ton of studies about this. You can look this up online. In fact, I encourage people listening to look this up. 1 in 8 women get breast cancer. So I often ask my patients, have they undergone any sort of tragic life event in the 5 to 10 years preceding their diagnosis? And almost always the answer is yes, whether it's loss of a child, financial hardship. And so these are metrics that you can't just study through the scientific method, right? You can't subject 20 women to stress and then another 20 women is the control group and then measure who gets cancer, right? That's just not ethical. But there's a ton of studies looking retrospectively at women who have breast cancer and who've undergone major life stressors. So 1 in 8 women get breast cancer that don't have a family history. And what can we attribute that to? I mean, there's multiple other factors, but stress is by far one of the biggest ones. It's just hard to measure.
It's so sad and terrifying.
It is.
So when you're looking at women, because those screenings mammograms start at 40 usually, right? Are they self-diagnosing and then coming into into the doctors?
Sometimes. And sometimes women are having really healthy, good discussions with their doctors about their risk factors in terms of family history. So they say, hey, I have a maternal grandmother and a maternal aunt who had breast cancer, and I think I'm at high risk. And that really should start at age 25. And at 25, if they're determined if they are high risk, then they undergo MRIs. When they get to about 35, they start coupling it with mammograms. But if you don't assess your risk, I see younger women in their 30s coming in with, I found a lump. And oftentimes when you can feel a lump, it's at 2 centimeters. So that automatically makes you at about a stage 2.
What's the difference in feeling it physically between a lump and a swollen lymph node?
Yeah, so actually not really much difference. They pretty much feel the same. It's just in terms of location. So a swollen lymph node would be under the arm, in the axilla or the armpit.
Okay.
And then a breast lump would be in the breast, so a breast lump. But they do feel very, very similar.
That's scary too, because if I were to be 30 years old and I were to be doing a self-breast exam in the shower, I would think, clearly, this is not a lump.
Yeah, and that's a very common story. It's kind of ignored, or somebody tells them, you're too young for this. We just can't do that anymore. There's no such answer as that anymore. You can't, if somebody feels a breast lump, it should be evaluated in the most appropriate way possible, because you're too young for this just doesn't apply anymore.
With the advancements in the surgery and the procedures, are you also seeing advancements in recovery?
Yeah, I mean, with these minimally invasive techniques, patients are having less pain, going home sooner, and usually it's a 1 to 2 night stay at the hospital, minimal pain and things. So yeah, recovery's better, definitely.
That's good, and that's good to end on. You stay right here after the break. One of those advancements that we were just speaking about, scalp cooling. We're going to talk with an expert about the technology helping patients keep their hair. Welcome back, everybody. Hair loss is one of the most visible side effects of cancer. But today, some patients have another option. It's called scalp cooling. Joining me now is Taya Wallace, Oncology Director at Sharp Healthcare. Thank you for being here. Okay, so what exactly is scalp cooling and how does it work?
Sure. So scalp cooling is still considered medical treatment. And it's medical treatment that essentially focuses on the principle of vasoconstriction. So I'm sure many of the listeners or people viewing are familiar with the concept that if you travel to somewhere with very cold weather, that a lot of your blood is going to shunt away from your periphery to kind of your heart and your lungs. This basically is a local application of that. So we actually take regulated cooling through a cap. We place it on your head before, during, and after chemotherapy. And what that does is it narrows the blood vessels that are leading up to the scalp, which means less chemotherapy gets to the hair follicles, which means that we can prevent or minimize hair loss during treatment.
Okay. So how effective is it and how long has it been offered?
Yeah, so there's a range of effectiveness. Certainly not everybody is eligible. It really does depend on the chemotherapy regimen that's been prescribed by your oncologist. Certainly we want to make sure that if you are getting a chemotherapy regimen that does not traditionally lead to a lot of hair loss, that we're not subjecting you to scalp cooling on top of that. And we want to make sure if you are getting a regimen that we know will likely cause hair loss, that we are giving you the option. So there's kind of that spectrum.
So, for medical terms, for listeners out there who may be going through this or have a friend or family who's going through this, who would be a good candidate? So what kind of regimen?
Well, there's a multitude of chemotherapy regimens out there. So what I'll just say is, in general, you want to have a conversation with your medical oncologist or whoever is prescribing your treatment to assess your own eligibility for the treatment.
Okay, so if someone's receiving a lot more chemotherapy, they might not be candidates?
No, it's really based on the type of chemotherapy drug that's being offered. Because there's different types of chemotherapy agents, and some of them we know pretty much for certain are going to result in hair loss, and there isn't going to be much that we can do about it. And then there are these drugs kind of in the middle of the spectrum where we think we can likely prevent hair loss by using this additional treatment.
Is this something that's covered by insurance, or it's so new that this is just an option for patients?
No, so insurance coverage is becoming more widespread. When we started implementing the program at Sharp Memorial a few years back, there weren't a lot of insurance payers that were covering it at that time, but we have seen coverage increase over the last couple of years, which is really great.
That is great news. Okay, so over the last few years that you've offered it, what's been the success rate? Do you have a story you can tell us where this person came in? Or is sometimes do people just lose a little bit of hair, or this is something that prevents all of it from falling out?
Right. So I would say we really measure success based on the way that patients feel as they're going throughout their treatment. It's not always about preventing hair loss in totality. Sometimes it's about getting to a special event where you know that you're going to be photographed and that those photographs are going to live on in perpetuity, and making sure that you feel your best self for that. Sometimes this will actually help get patients to initiate treatment faster. We do have patients where, hair loss is really a pretty devastating concept for them, and we do have patients that can potentially delay initiation of treatment because they're worried about that. So this really helps us move treatment to where it should be initiated to ensure that patients have optimal treatment outcomes.
Does it hurt?
So there is some discomfort associated with it, is what I hear from our patients that go through it. I have not experienced myself, but yes, essentially it's a cap that we fit to your scalp. It is attached to a small portable machine that we keep in our infusion center that is a regulated cooling device. And patients basically wear it for 30 minutes before their chemotherapy starts, for the entire duration of their infusion, and then for a couple hours after their infusion ends. And people say it feels like essentially you have a headache while you're going through the treatment.
But if you can get through that, you're a tough cookie.
Yep.
Now, one of the things people would probably ask you about too is, does it cover the eyebrows? Because you potentially could lose your eyebrows as well, right, through treatment?
Yeah, so it doesn't cover the eyebrows because it is localized to the scalp. So really with the whole principle, where the cooling sits during treatment is where those blood vessels are going to be narrowed. So oftentimes we do still have patients lose their eyebrows, even if they are going through scalp cooling. But then we work with other integrative programs like Lipstick Angels, who then works on teaching patients how to draw their eyebrows in, facials during treatment, kind of all of those other integrative pieces to really, as Dr. Berry talked about, making sure that cancer takes less from you.
Yes, absolutely. And tell us really quickly, we're already running out of time, the emotional benefits of scalp cooling.
Yeah, so everybody has a different sense of identity and sense of self, and for a lot of people that can be tied to your hair, and for others it's not tied to your hair at all. So it really depends. But for a lot of people that are private about their diagnosis, being able to keep their hair while they're going through treatment kind of means that they can go out in public and not have kind of this public badge of I have an illness or I'm going through treatment. And it can also really decrease the amount of social isolation that we see in patients while they're going through treatment, because some people will shy away from normal events that they would have gone to because they're not sure how other people will react when they see that they have lost their hair. So it can really help prevent that social isolation, which is so important.
Beautifully put. Okay. All right. Up next, we are going to meet a woman whose breast cancer diagnosis came while she was planning one of the happiest days of her life, and how keeping her hair helped make her feel like herself during the process. Welcome back, everybody. At just 31 years old, our next guest discovered a lump in her breast. So instead of planning for her wedding, Allie Bradshaw had to plan for her cancer treatment instead. Allie, thank you so much for being with us and sharing your story. It's incredibly personal, but we want to start with the good news. You've been in remission now for how long?
Almost a year. It's kind of hard to say, but yeah, I'm feeling great.
Congratulations. We were just commenting before this episode started about how beautiful you are and how glowing your skin is. You would never know. You look beautiful and you look happy and healthy.
Thank you.
And you were telling me off camera you just started back to work when?
Yeah, 2 weeks ago, actually. Yeah, this is my second week back.
So dealing with something so incredibly heavy like cancer, and then you love what you do for a living. It's a calling. Tell everybody what you do.
Well, I am an oncology nurse at Sharp Memorial, and I just transitioned roles into becoming one of the oncology breast navigators.
Incredible, because you have the experience with it now, and I'm sure your deeply personal situation can help you take care of your patients better as well, I assume.
I hope so.
Yes, but dealing with this and then going back to work, not working through this, that had to be tough for you as well with all you were dealing with too.
Yeah, I mean, you kind of lose like a sense of purpose in a way, but honestly, it was kind of nice to just get away and focus on my health and, yeah, getting better, getting through it.
Can you tell us how you felt initially when you felt that lump in your breast?
Yeah, it was pretty crazy because I had just had an appointment with my doctor a couple months prior, getting like a pap smear, and they did an exam, but mine was a very fast-growing cancer. So I found it myself only 2 months later, but just like lying in bed, all of a sudden looking down and saying like, oh, there's something there, and then feeling it, having my husband feel it, be like, that's not right, and message the doctor.
Did you feel weird or tired or any other type of way?
No, I found it while we were on a ski touring trip in Colorado, and yeah, I was doing great. It was very random.
Kudos to you for reaching out to your doctors right away. This was stage 2?
Yes.
Okay, and so talk to us about your treatment plan and how scalp cooling really worked for you as well.
Yeah, so I was excited about the scalp cooling because my wedding was about 4 treatments in. So I knew I was going to start seeing that hair loss. And I had like really long, pretty red hair.
Yes, we're looking at your wedding photos now.
Oh,
My
yes.
goodness.
So I was happy to have scalp cooling just to have those wedding photos. And honestly, I'm not the type of person who really cares about my hair. Like Tay was saying, everyone's different, but something like a wedding, like these pictures I'm going to have forever.
Yeah.
So it was important for me to, look like myself. And then I was excited to have my Britney moment the next week and shave my head.
Gorgeous pictures. You would have looked beautiful, G.I. Jane, or the long hair, just letting you know that. But it does feel good to know that you had that option, I'm sure. So let's talk about your husband, Luke. He was with you through this whole process. What did he do that meant the most to you? Because I'm sure it's hard for partners as well going through this process. What advice do you have for others of partners of cancer patients?
Yes, I mean, I am blessed with a super emotionally in tune husband, and sometimes it was harder for him than it was for me because he's seeing me go through all this, and he just always said, like, I wish I could take the pain or whatever I was feeling away. But I think just my advice would be to just like try as hard as you can to stay strong and be the rock for your partner who's going through this. Like he said he felt like he became a man in this process. He already was a man, but he said, and he truly became like my rock, and he changed like emotionally and was like my stability and like the person that I could turn to for anything. So I think just, yeah, becoming that rock for your partner is really important because they need you.
That is great advice for others out there. Now, emotionally for you going through this just by yourself, what did you do right in your head, and what would you tell yourself from the beginning now that you're on the other side of it?
Honestly, I think something that I'm proud of is I tried to not let cancer be my identity. I tried to keep up with a lot of my hobbies, even if it wasn't at the same level. I tried to still see my friends and family. Like when it was appropriate for my immune system, I went to events still. I still traveled. I would, instead of going on a big long hike, just small walks. I tried to not let it change my life too much. I just wanted to feel like myself still. So that's advice I would give to women, is just don't let cancer be your new identity. Just be yourself.
And your checkups now are every 3 months?
For now, yeah.
Okay.
Every 3, 6, yeah. So Oh yeah, that's what we like to do. Fly off mountains. I wasn't exactly doing
the
that.
base jumping, right?
Paragliding.
Oh, paragliding.
Yes.
Okay. We got that wrong in the notes. Paragliding. That's scary. So this was before, because I know people have a different sense of self afterwards. Was this a before thing? You were
no,
like this?
Oh yes, before, and I couldn't quite do it, and that was really hard for me during treatment. But that was us on our honeymoon just a month ago, a
Look
delayed
at
honeymoon.
you go. Oh, wonderful that you can get back into something so fun.
Yes.
Okay, stay with us right here. We're going to take one more break, and we will have some final thoughts with Dr. Barry and Allie up next. Welcome back, everybody. Okay, we have a quick 2 minutes to wrap this up. So, Dr. Barry, what symptoms should women never ignore?
So really important to pay attention to the shape of your breasts, the contour of your breasts. It's not enough to do a physical exam in the shower, which is what I tell my patients. It's important to stand in the mirror, know what's your normal, lie down, examine your breasts while you're lying down, examine them while you're standing up, and visual inspection. You need to be a boob detective.
Love that. I love that. Okay, Allie, and for our viewers out there, what would you say to someone who just received the same diagnosis as you had?
Yeah, kind of like I said before, just don't let cancer define you. I think patients do better when they have a better mindset, which obviously that's hard, but I think by being yourself and doing things like continuing to see friends and family, don't just isolate yourself, like continue doing hobbies. Like I may have not been doing extreme sports, but I became like an extreme puzzler. Like just do whatever you can to
That's art in and of itself. All right, no, that's good information, and I love that you said this before too. Okay, so maybe you're not taking a 10-mile hike, but just a short hike. You were still doing the hikes, and that's a mindset in and of itself. All right, Allie, Dr. Barry, thank you for joining us, and Taya Wallace as well. And thank you. We have more information for you available on CBS8.com. I'm Stephanie Simmons, and this is The Backstory.